Well, specialist rehabilitation is a multidisciplinary evaluation of someone's needs after injury or illness, and it involves a team, usually a consultant in rehabilitation medicine, physiotherapists, occupational therapists, speech and language therapists, rehab nurses, psychology, dietitians, lots of different people, addressing the different needs of that individual after they've sustained a life-changing event or a prolonged illness and progressive illness. And within it, the focus is very much as well on the diagnosis of what's going on and preventing secondary disability. It's also about maximising function and participation in life again. So it's very much about helping that individual manage their condition, improve that condition where possible, and maximise their engagement in daily life again. Well, first of all, a multidisciplinary assessment of patients' needs is common to all rehabilitation approaches, and within that there may be medical interventions that are needed, an evaluation of pain, management of mobility, thinking, speech, and mood, trying to help someone address some of the ways they may feel about what is often a life-changing event. The most important thing is having the right amount of time with the right expertise. So I often think of rehabilitation as a drug like any other. It needs to be given at the right dose for the appropriate length of time to optimise the outcome for that individual. And alongside that, we have a number of different tools we can use, which include specialist equipment, including robotics, also interventions like botulinum toxin injections for spasticity, and also specialist seating for people who have paralysis or needs, which mean that they need additional help accessing the community and being outside with their families. Well, the length of the rehabilitation journey often depends very much on the cause. So someone may have mainly physical problems and will benefit from a relatively short but intense period of physiotherapy, occupational therapy, but others may have potentially catastrophic, life-changing problems, and that will require a longer period of time to help that person maximise their recovery, because in that domain it's the interplay of the physical needs, the cognitive needs, the speech needs, as well as any medical or surgical requirement that they may have. Yes, specialist rehabilitation covers a range of different disorders, including musculoskeletal problems. Mainly we are supporting people who have complex orthopedic injuries, for example, pelvic fractures, lower limb fractures, often with associated nerve damage related to those. We also care for patients who have had an amputation or are preparing for an amputation, offering service before that amputation so that they are prepared for it and ready for the surgery, and after amputation, where they can have a multidisciplinary rehabilitation and links in with our partners at Dorset Orthopaedic to optimise prosthetic rehabilitation, which is something we support at Cleveland Clinic.